A little bit about our interviewee today, Dr. Arpita Judy. Dr. Arpita Judy, DDS, provides both general and cosmetic dentistry in the Austin area. She takes great pride in her mission to care for her patients and her sheer passion for general and cosmetic dentistry. She describes herself as being every bit as passionate about dentistry today as she was during her first day on the job. Dr. Judy completed her undergraduate studies at the University of California, Irvine, and due to her outstanding performance and achievements there, she was accepted into dental school a year early at the prestigious University of Southern California at the young age of 20. She graduated with high honors and earned her Doctor of Dental Surgery in 1998. Dr. Judy went on to complete her postgraduate General Practice Residency in 1999 at the Dallas VA Hospital. She carries a number of certifications related to general and cosmetic dentistry, including oral conscious sedation, nitrous oxide sedation, usage of the Cyro laser, CEREC one-day dentistry, and Invisalign.
Hi, my name is Dr. Arpita Judy, and I'm a dentist at Avery Ranch Dental in Austin, Texas. And I've been a dentist actually for 28 years, but at Avery Ranch Dental for 20.
Where did you go to school?
I went to school at the University of California at Irvine for undergraduate, and then I was a biology major, and then I went to dental school at the University of Southern California.
So how many years was that education in total?
So my situation was a little more unique in that I actually didn't graduate from the UC Irvine. I was able to finish my biology credits in 3 years and applied to dental school and was able to get in a year early. So I did 3 years versus 4, and then dental school was 4 years, after which I actually did a 1-year hospital residency. So I did 8 years total, but usually that would have normally implied 9 years.
Did finishing your college course a year early cause any challenges for you?
It was very challenging. Actually, part of the reason that I had to do that was my father, as Indian parents always are, want your children, a lot of them want their children to go to med school. And once I decided that medical school was not for me, and found out I wanted to do dentistry, and we found out that we could actually apply after 3 years and finishing up your requirements, it was pedal to the metal. And so it was very challenging taking on extra credits or extra classes in 3 years and condensing it and getting also the dental entrance exam taken care of. But, it's doable.
So did it give you any obvious advantages over other people who maybe took all 4 years?
It actually did not. It actually was a disadvantage because there were a lot of students in my class, in my dental school class, that actually had master's degrees because they went on and completed a master's degree, which I think something like that does give you a definite advantage. So I've actually had some students who finished up 4 years and then spent a year being a dental assistant. Just learning what dentistry is about. So that gave them a big advantage as well. So you're able to do it in a lot of different ways. I was also one of the youngest kids in my class. So that kind of is a challenge as well, right? The immaturity level and stuff, that definitely is there. But again, at any time, those challenges are there. If you just really are passionate about what you want to do, it's all possible.
What made you passionate about dentistry over medical school and other things?
So again, that's a very interesting question. So I was a biology major because all my life, it was ingrained in me to go to medical school. I mean, just like a lot of kids, right, out there. First semester of my first year, that's when you start realizing, okay, I know what I've always said all my life. I want to be a doctor. I want to be a doctor. But then suddenly it becomes real. And it's like, well, this is what I'm going to do for the rest of my life. And I'm like, I don't know if I talked to other kids and started really researching it and was like, I don't know if this is really what I want to do. Back when I was going to school, we did not have Google or internet. It was a long time ago. And so I had to pick up the college catalog, and I was like, I have a biology degree. What do I do with a biology degree? Looked at pharmacy, dentistry, started looking down at everything. I really liked to I was artistic, like to, do hands-on stuff. And so I actually took a course at Loma University. They actually offered just a weekend course of pre-dental, if you want to be a dentist. And I just loved it. I tried pharmacy, went and observed a pharmacist, and there was not a lot of patient one-on-one interaction. And the day just dragged on all day. And with the one day that I went to a pediatric dentist's office, I mean, I looked at the clock and five hours had gone by like that in an instant. So that's kind of when I was like, this is what I want to do. Now, the challenge was telling my parents that's what I wanted to do. So that's a different story in itself.
So do you feel switching gears on that course was worth it?
Absolutely. Now I've been a dentist. I graduated dental school in 1998, and I've been doing dentistry since then and love it just as much now as I did when I first started. So I think part of it is because I feel like I made that choice, and it was something that I really wanted to do. And I commend you girls for having this channel, because a lot of times you don't have an opportunity to hear about different careers. And so this is really neat. But yes, I love what I do.
Thank you so much. That is very, very sweet. So what does your day-to-day life look like?
So another good thing about dentistry is that it is kind of an 8 to 5 job, or it can be the hours you set. It depends. If you own the practice, it can be the hours that you set. So I work 8 to 5, and I see, as most of you probably have gone to the dentist for a dental checkup, and if your teeth are healthy, then that's probably where it ends, right? And that's all you guys know. So in the office, I've got my hygienist. And so on the hour, usually I'm going in to do my dental checkups, which is when you've probably seen the dentist come in and look at your teeth and go, everything looks good. We're good. We'll see you in 6 months. But if you do have cavities or broken tooth or something like that, well, then that's what I'm taking care of. And usually I am seeing patients every hour, hour and a half to 2 hours, depending on what treatment they need. So I've got several rooms that I'm going to. In between, while I'm treating the patients, I'm going to do the dental checkups. And a lot of times patients have been my patients since they were 3 years old. I've got patients who I've known since they were 3, and now it's crazy because all these years have gone by. They're graduated college, married, having kids. And so a lot of that is the social interaction. So not only you're doing dentistry, but you're also talking with the patients, seeing what life is like. And so you have to be a real people person for this job, for sure.
As a dentist, what are some other tasks you do to your patients on a day-to-day basis, other than like just normal checkups?
So we are doing, unfortunately, sometimes people don't take care of their teeth. So we actually, when you have cavities, you have holes in the teeth. So we're, I'm anesthetizing or numbing all the patients. So my degree is, you see it at the end, DDS. It's Doctor of Dental Surgery. And so dentistry is invasive. I mean, when you compare dentistry to, say, a medical doctor, family practice, you're going in and you're not sitting there and cutting a patient, I'll use those terms, but you're doing invasive treatment on every patient or a lot of patients, right? So that's always very challenging because nobody likes that. So having to navigate dental anxiety, the patient, making them comfortable, and then actually doing invasive procedures. And that is day to day, hour to hour.
So we read in your bio that you do both general and cosmetic dentistry. Has that affected your day-to-day life at all? And is it normal for dentists to do both?
It is absolutely normal for dentists to do both. So in a day, as you all were previously asking, I will go from doing a small little filling where someone's chipped their front tooth to making that tooth look, exactly what it looked like before that chip happened, which is amazing. And that's usually the fun part of dentistry because no one wants to walk around with a chipped tooth, right? So those patients are super, super happy. But then we've also got, right after that, we've got a patient who's in severe pain because they have a dental abscess, an infection. And unfortunately, sometimes it's because the tooth is cracked in half and we have to take out the tooth, which literally means extracting, taking the tooth out of the mouth, right? And so those patients, I mean, there's an emotional component to that. No one wants to have a tooth removed. So you're almost part therapist, kind of, helping them, kind of cope with the fact that they're going to lose a tooth. But then we also replace the teeth. So in the same day, I could be placing an implant. So where you've got a tooth missing, nowadays, bionic teeth, we place implants and then put crowns on top of it, and we completely replace a tooth. So the challenge with dentistry is, yes, one, you could be doing something as simple as putting sealants, which a lot of you have had on a 6-year-old child, and the next thing I am treating doing a filling on a 80-year-old dementia patient to a 40-year-old soccer mom. So you're seeing different patients, different walks of life every minute of the day. The day goes by so fast. It's great.
So one of the main reasons we started this is to see what kind of classes we want to take in high school for our career path. Are there any other skills other than being a people person that you would recommend knowing before you start your education in dental school and things like that?
Absolutely. So being a dentist, if you don't have the art, if you're not an artist, if you just don't have the hand skills or just, it is very, very difficult. So if you think about a lot of the things that I do for upper teeth, I'm actually doing the work looking through a mirror. And so if you look at a mirror, everything is in reverse, right? And you get used to it, but literally the brain like flips everything that we're doing. Also, doing fillings, it's depth perception. Like you have to, when you're looking at something like how deep something is, it's a unique trait. It really is. And if you are not, if you just don't have that, it's very difficult. So that being said, how do you know if you have that or not? What can help you? Taking art classes sounds kind of interesting, kind of different for a biology major, right? But dentistry is not all just science-based. You definitely do have to have that artistic knack to really enjoy it. And so I don't know if they require this anymore, but they did require us or recommend taking a sculpting class or an art class, because when you're looking at shadows of things, and if you really can see that and enjoy it, if you try to take an art class and fail miserably, dentistry might be a little harder for you, so it's just something to consider.
So dentists lead very busy lives. How do you maintain a good work-life balance?
So you are right. They lead, dentists, and just in general, everybody lead really busy lives. So for me, I've got a daughter, just like you guys. She's 18 now, and dentistry, that is why I picked a dental profession. I didn't know what kind of family I would have back when I was trying to pick a profession, but I wanted something that was 8 to 5, or days that I if I plan ahead, I can work 8 to 2 so that I can make my daughter's volleyball games, or make, special events that are at school, and work around that, because ultimately I wanted to be a working mom, and for that, I think dentistry works out very, very well.
Okay, so do you own your own practice, or are you part of a group?
I actually do not own my own practice, and I am an associate at the office, and I'm part of a group.
So how is that different than maybe being a co-owner or an owner of a practice?
So there are a lot of differences there, and dentistry offers you the opportunity to be a business owner, which actually a lot of individuals do like. I mean, where you can actually be an entrepreneur, and a practicing dentist. For me, and that's again personality, right? What works for you is that a business owner, it's hard to shut off. When I talked about the 8 to 5, well, dentistry does offer you the 8 to 5, and does offer you if you're a business owner, setting your own schedule. So you could work 8 to 1, 4 days a week if you wanted to, if that's what you'd like, and have associates take up the other rest of the time. But for me, also with being a business owner comes hiring, firing, managing a lot of the bills. When stressful things like COVID happen and you have to completely shut down, you still have to pay your employees. So there's a lot of stressors that a business owner has, but there's a lot of pros to that. In the end, all the profits that come through, rather after you pay everybody, there's more profits there, right? So that management fee is what a corporation is actually doing at our office. And so with that, then that takes away the managerial aspect for me to a point. And then I can just work 8 to 5. You're never, as a dentist, you've always got hygienists, dental assistants, front office staff, insurance. And even if you're not the boss, you still are managing them, right? Because ultimately I'm not paying their salary, but day to day, I'm the one that's dictating how the practice is run or what's happening. So part of being a dentist is you also are managing a group of individuals.
So how do you split the responsibility between you and your other team members, your co-owners, your other associates?
So we do it as a team. We're a leadership team. So we meet weekly to discuss how we want the practice what direction we want to take the practice, or if there's any issues with how things are running, then we actually talk as a team. And it's nice. That's the nice part of actually being in a group practice, that all of the responsibilities aren't shouldered on you, on one person. And and then at that point, whoever has the strengths, I'm blessed that, we're at a practice that each of the associates have a strength of, I take care of, there's one that loves the business aspect, like making sure, we're doing that and talking with the corporate offices and making sure that's running well. I'm the social person, so I make sure the staff is all very happy and content. So each of us have our strengths, and we work well. We just work as a team and divvy that out.
What are some challenges you have faced throughout your career as a dentist?
The biggest challenge, again, as easy as it is I think this challenge is there for any working mom, and so the challenge is having to deal with life at home, and then wearing the hats of being a mom, a wife, and working, right? A big challenge with dentistry, though, is that when I get to work at 7:30 in the morning before patients get there to when I'm done, whatever's going on at home, whatever the stresses are, whatever, it's locked up at the desk, and I have to be 100%. And so that's challenging. If you're not feeling well one day, you got a headache, but you're giving that patient 100%, right? So I think that's always the biggest challenge. That'll never go away. I would say is my biggest, is just being on 24/7 when you're at the office.
So as a dentist, you have to be really close to patients and in their mouths and things like that. So how did COVID affect your dentistry and what you were working?
So it's interesting. So at the time COVID happened, I had been practicing dentistry for almost 22 years, and being close in a patient's mouth, having obviously aerosols all over you all the time. Even when I had a child, I'd make sure as soon as I got home, before picking up my daughter, taking a shower, wiping down with alcohol, did all of that, but still it mentally didn't affect me. With COVID, that sure did, because the whole world shut down. And once we opened back up, when everybody still was at home, we were back at the office seeing patients. And suddenly it became at the time, a high risk job, right? And so that's when you realized how high risk it was. But again, it's one of those things. People still need to be seen, still need to be taken care of. So the precautions we took before, and we've always taken precautions of, we've got a mask on, eyeglasses, constantly washing our hands. That just got taken up a notch. And that was more for our protection than the patients, because the patients were always protected, right? So it was challenging. And I will tell you, at that time, there were a lot of dental hygienists that actually quit dentistry because that was something they emotionally or mentally weren't prepared for. I will tell you now, 4 years removed, dentistry is right back where we were pre-COVID, because again, world goes on, we continue. So it did affect us for the short term, but we're right back doing exactly what we did before and what we've been doing for hundreds of years, for 100 years, right? So I think it's fine now. It was scary at the time, but it's fine now.
What are some of the most rewarding moments of your career that you've experienced?
I think with cosmetic dentistry, those rewarding moments is when someone, a teenager was just, a girl running, just walking, slips and falls and breaks her front tooth and is mortified. Like, I cannot go to school. How am I supposed to go to school? Get that phone call. We fix her tooth, put her right back, and she cries, sheds tears because, again, it's emotional, so that's the fun part, is fixing that. Or someone who's lost their front tooth because of a car accident, and where we're able to actually do an implant, replace the tooth, and they have their smile back. So a lot of the getting their smiles back, those are fun. I think they're very rewarding. And patients that are in a lot of pain, they come in crying because their tooth hurts. They can't eat, they can't sleep. And the minute we numb them up and take them out of pain, and just the gratitude for that. And it's just, don't ask for the gratitude, but it's just neat to see that you're making a difference. Oh, and the hugs sometimes you get from those little 6-year-olds who are so scared to come in, but then they leave and they give you a hug and say, I'll see you in 6 months, where they didn't even, they're crying, come into the chair. So those are fun too.
So for cosmetic dentistry, just because of the term cosmetic, a view that some people might take is that it's very superficial, that you might get it like just for the look of it. So how do you feel about that?
So it's how insurance companies kind of explain it, right? And so they describe it as cosmetic dentistry is anything kind of to make your teeth look better. But that's not necessarily the case. They could have broken teeth and they're rough. And so we kind of generalize and put cosmetic dentistry into a category that necessarily isn't just cosmetic and just to, like plastic surgery, it does not have to be just for lack of looking better. A lot of times it's for function. That sometimes it gets a little muddy. The water gets muddy, and a lot of it is because of insurance coverage.
Your examples make it a lot clearer. Thank you.
Yeah.
With doing similar procedures for as long as you've been doing it, does it ever get boring?
It doesn't. And for me, it doesn't, because it's not the same every day. It's not the same every hour as a dentist, because again, like I was saying, you could be seeing, a 6-year-old doing a filling, you're doing so many different, dentistry has so many different procedures. And on top of that, you're talking with the patients. And so that's one thing I feel it is not in all these years. You're constantly learning. I'm learning every day, because we're working on a body, an individual, it's a human body. And so things don't always go the same. They don't always work the way they're supposed to, because it's attached to a human body and things change. So definitely dentistry is always working on the fly. Like, things change and we have to, work around that. And that's where that's a good thing, but then it's a hard thing as well, that you're always on your toes, because you can't be complacent ever with it.
So would you say that the personalities of your patients are what make your job interesting?
Yes. And as you were mentioning, I'm in a group practice, right? So the funny thing is that when all the doctors have different personalities, and over the years, as patients, they meet their patients come back to see them. Each of us have our own little kind of sect of patients. And those patients all have similar personalities, because if you're going to be a patient of mine, you have to like the way that I talk or treat people, or, but we've got some patients who are like, Dr. Judy probably talks too much. I want, or she's, very handsy, with her hands. And so they want someone a little different personality, a little quieter. And so we've got, someone else. And it's funny, over the years, there's a certain patient type, I guess, each of us have. So it's funny you asked that, but that's how it works out.
Are there orthodontists in your practice that you work with?
So there are not any orthodontists in our practice that, so we refer. So when you have specialists, you can either have a group. So we've got a group practice where we have different specialties come in. In dentistry, there's different specialties. Periodontist, and a periodontist is a gum specialist that's looking at your gum tissue, doing different grafting or implants. We have an oral surgeon that takes out wisdom teeth. The orthodontist straightens teeth. There's an endodontist. Endodontists are specialists that do root canals. And so you can have a group practice that has everything. We have just got an oral surgeon and a periodontist at our office. So with all these specialties, general dentistry, with what I do, you are licensed to do it all. We've got general dentists who do wisdom teeth extractions and root canals, braces. You can do that. A lot of general dentists. So again, as a general dentist, you're wearing, you're doing everything. But some just prefer to do certain procedures and then you just become specialists at that. And so for me, I don't place braces. I do Invisalign. So you can do Invisalign. And then the harder, more complex cases, I refer to the specialist. So that's where I like general dentistry, in that I can do what I want to do. And more difficult, complex cases, I send to the specialist. And keeps my life stress-free. And then the specialist, I feel that the patients are getting great treatment with the specialist when they need that.
Are there any specific reasons why you didn't choose to specialize back in college, or just why you didn't choose?
So I actually I had gone through the process and had gotten into endodontics, so root canal specialist. So I was actually really contemplating that, because when you get out of dental school, right when you graduate, everybody's like, I want to specialize in this, and so a part of it is the ego, it's like, hey, I want to specialize too. I've got the grades. I did well in school, and so wanted to specialize. I got accepted. I was supposed to start specialty training in endodontics, and before I acceptance letter, before I signed it, it was hard, because I was like, well, now I'm limiting myself to just doing root canals. And I enjoyed a lot of the other stuff. And so I actually made that decision of, I don't want to give up doing fillings and crowns. I actually like everything, and I still can do those root canals, the ones I want to do. So why limit myself to just one specialty? So I actually chose to be that's why I chose to be a general dentist.
So how many extra years would it have taken to specialize in it?
So each specialty is a little bit different. Most of them are 3 years. So after you've done your 4 years of undergrad, you're doing 4 years of dental school, and then you're doing an additional 3 to 4 years of specialty training. So it gets up there. For oral surgeons, it's even longer. So when you go to the oral surgeon, a lot of them, there's a 6-year MD oral surgery program. So several of the oral surgeons will not only have done 8 years to become a dentist, and they're doing now 6 more additional years, and 2 of which are actually doing medical school. So a lot of oral surgeons actually have a medical degree and a dental degree, a dual degree. So it's a lot. It's a lot, but and you think, oh gosh, it's a lot of schooling, right? But like of dental school, when we did the 4 years of dental school, 2 of them are didactic. You're in a classroom learning dentistry. The last 2 years you're doing dentistry. You're a dentist, but the school is getting paid for you to be a dentist, but it's kind of like on the job training. And specialties, those 3 years, that's what you're doing. You're doing a lot of dentistry. So, but it's a long process.
We know med school can cost a lot of money. So how does that compare to dental school, and how do you deal with the student debt?
So dental school, along with all postgraduate educations, the cost of tuition has gone up exponentially. When I went to dental school, it was not as expensive as it is now. So how, like, a lot of it again right now is, that's a whole nother talk about where payback is. You know, a lot of it right now with dental school, it is very expensive. Loan repayment, there's actually that 20-year loan repayment, as what I talked to with my younger associates, how they're handling that, is you're paying back the loans based on a percentage of your salary. Right. So when you look at that, it is still an overwhelming amount of money. Right. So there are other options. So one option, and that's something interesting that a lot of kids don't want to do, but my husband did that actually. He's an orthodontist, and he had dental school paid for through the military. And so, which you can. So you get a, your commitment is afterwards you're doing 4 years in any of the branch services, Army, Navy, Air Force. And you think about it, it's not going overseas and fighting. You're a dentist, right? You're just at a base, and they 100% your dental school is paid for. And then 4 years later, while you go into the military as a dentist, and you're getting paid to be a dentist, but you're in essence paying back those 4-year commitment, and you leave debt free, and you've now had 4 years of time to grow as a dentist. So, so learning and stuff, and it's a great opportunity. So that's something we've talked to our daughter about. That's something that, is a good option. And there's a lot of women in the military, and you're doing dentistry. You're not out there, with guns fighting. So it's an option. And also there are options in the public service aspect. So there are, for rural, if you're willing to go to rural areas, there are the public service as for Indian reservations, and they also do loan repayment. And there's also, you can work just a couple of years in rural locations and health clinics for underserved populations, and they have a loan repayment. And so those are all great opportunities you do a couple of years, you gain that experience so that when you do go out into the private practice, you don't have the burdens of your loans. And then you've also got experience, because when you look at these corporate offices that are looking for associates, a lot of them are looking, you want to make sure you get a good place to work at. And those are going to want to have for you to have a couple of years experience. So those are all different options.
So you previously mentioned that you didn't go for a master's degree while other people maybe did and got an advantage. So did you find yourself competing with those people that did get a master's?
I did. So actually I was number 3 in my dental school class, and the 2 people, and the number 1 girl was my friend, and I competed with her. She had a master's degree. And so there were a lot of classes in dental school, the first year biology classes that I had learned from a book, because I didn't necessarily it wasn't a requirement to take that class. It was a requirement to do well on the DAT. So I learned from a book. So it was that part was a disadvantage. It just made me have to study that much harder for those classes, whereas you could have spent the time learning something different, so it just made it a little harder. I do feel we've got a dental assistant, a girl that was a dental assistant. She's now in dental school, and she spent a year with us learning, and she was a dental assistant, has learned so much. And I feel like that really has put her a leg up in dental school where she's at, and where these students are learning about teeth numbers and stuff about teeth where she already knows that. So not only the master's program, but just having work experience somewhere, it really gives you a leg up and just gives you more time to study other things and to do well in school.
So in the dentistry profession, how exactly would you progress up the career ladder?
I guess with dentistry, when it comes to, unlike a corporate job or something, progressing up a career ladder is just doing more procedures, right? Being a better dentist. When you are taking, learning and doing more procedures, that's how you are. So in dentistry, we get paid on what we do, and so the more complicated procedures that you're doing, the higher production there is, and the higher production, the higher pay you have. So with it is just constant continuing education courses, is taking continuing education courses to learn more of the complex treatments, placing more implants, doing more of the Invisalign. But that doesn't come from, you don't learn that. You learn the basics in dental school. When you get out of dental school, you're constantly doing continuing education classes. to just learn more procedures.
So how has technical evolution over the past 5-10 years made your job easier?
So it's made it more interesting. Sometimes it can be a little bit more challenging because with technology, it works for us, it doesn't work for us. But over the last 10 years, with technology, we have digital charts. So back when I started dentistry, they were all paper charts. Everything was, so when someone wanted to come in, you looked at a huge wall of charts in alphabetical order. And if some of the hygienists had misplaced the chart 6 months prior, we couldn't find it, right? And it took hours to look for it. So it's definitely made us more efficient. If any of you have had braces and retainers, you've had those impressions, those molds, those goopy molds that were taken in your mouths. Well, we have a scanner, so we do instead of those molds that cause people to gag and, salivate a lot, it's a 5-minute mouth scan, which is just more accurate. We can save the images. So things have just become more efficient. We do crowns, we take molds, we take impressions to send to a lab. And now we can actually just scan and an email and like a digital file, and the lab gets it. So we can get the crowns back a lot faster. We also just recently now is incorporated AI software into dental radiographs. So the x-rays that are taken that you guys have probably seen, where the dentist is looking, going, you have a cavity there, you have a cavity here, or hey, your teeth look great. Well, there's now AI software that looks for different densities in the radiographs and kind of keys in. So it's making us sharper in what we do, where my eye would scan a radiograph. I take what I see with a grain of salt because that AI will in time get better and better. But there's just different tools to help assist us in dentistry now. To make life a little easier in that sense. One thing dentistry is always, though, you're working in a small place. And so I think with dentistry, being a female it does help you there, but a lot of it is digital technology is helping us, but most of it, we're still in the mouth working. So it's a tool. It's helping. It's definitely making things more efficient.
What is one thing, if any, that you don't like about your career?
I think it's hard on the body. Again, we're working in a small space with a small moving space. It's a lot of saliva. So it takes a toll on your body. That's just something that you've got to, I've got a special chair that I sit on. I wear a loop, special glasses. I 20/20 vision, but special glasses to keep my posture upright. You start noticing in your wrists and hands as you just get older, it's one of those things that, everything depends on, it's very physical, so I think that's the challenging thing, and it's hard, but it's one of those that if you always listen, like at a very young age, from when you start dentistry, you have to listen to your body. If your neck hurts or it's sore, because the way you work is you got to position yourself. You have to sit back and go, hey, we got to take this a little slower, and I got to make sure that I'm in a good posture and things like that. So that was something a mentor told me years and years ago that sticks by me all the time. And I try to tell that to every young dentist I meet is, it's loud too. So you have to, sometimes this is not what I'm great at, but wearing ear protection, and time the instruments are changing and things like that. But with that handpiece that we use, it's very high pitched. So it's just the challenges and the stressors it takes on your body would be what I would say.
Do you think being a dentist is a career to consider?
Absolutely. And I feel, again, I may be biased because I'm a female, but I think it's a great career for a female. You can have a great work-life balance. I think patients really relate to a female, because again, it's being comforting for children too. All, the kids you see, even men, it's just, we have smaller hands, we tend to have smaller hands. And it's just that comforting aspect of it. I think women dentists we do well. We do well because of that. I think I think it's a great career. And I'm blessed that I decided to choose that career on my own. But I'm blessed to choose that. My parents this isn't what they wanted me to do. And now they've looked back and said, this is the best career move you could have made. So yes, I think it's a great career choice. One other thing that why dentistry is such a great career, it's a very stable profession. When it comes throughout, I've been doing this for almost 30 years. And one thing we've gone through a lot of economic downturns, right? A lot of recessions. I became a dentist right at the heart of a recession. Every 10 years, that dip happens. One thing I can say, and I've got friends and colleagues in a lot of different professions. And the one thing is I always had a job. I always had a stable job. Didn't have to worry that I was the risk of being laid off, having to move. Like once I established myself, I'm in one space. Like this is, I've been here a long time. Once you establish, so I don't have to move around a lot, unless you choose to. I mean, you can have that where you can travel and stuff. And there's other ways of doing that. There's locum tenens. And so at a young age, you could move around and temp and stuff, but the stability of it. And it's a great paying job. And the longer you're in an area and the more patients you establish, the practice, once you build it and establish it, the more lucrative you are, And so I just think it's been a great profession.
Thank you so much. This was all really helpful and informative. Thank you so much for talking to us.
You're welcome. And again, it's a great thing you guys are doing.
Thank
Thank
you.
you.
Thank you.
Here are the takeaways from today's video. You can try out being a dentist by shadowing, which means following one for a day. Being good with people is super important, not just fixing teeth. Art skills like sculpting can actually help you be a better dentist. Dentists often get to make their own work schedules, which is a cool perk. Cosmetic dentistry helps people feel better about themselves. It's not just about looks. You don't have to specialize. You can do lots of things as a general dentist. Military services or working in certain places can help pay for dental school. Dentists earn more money when they do more complicated procedures. Dentistry is a job that's usually safe and steady, even if the economy changes. Continuing to learn new things is a must for dentists to keep up with the latest techniques.
Hey guys, hope you learned something new from this video. Please make sure to like, subscribe, and share with all your friends. Bye!